Have you ever had an X-ray or an MRI and been told that you have degenerative disc disease? If those words sound scary, trust me, you are not alone. Many people hear degenerative and they immediately think that their spine is just gonna crumble and fall apart. But what does degenerative disc disease actually mean? Is it causing your pain? Can it be treated? And does it mean that you'll eventually need surgery? These are the questions we get all the time in our office. I'm Dr. Garst with the Well Chiropractic Clinic here in Mesa and Gilbert, Arizona. And in this video, we're gonna break down what degenerative disc disease actually is, what you can do to take care of your spine, and what you can do about it. So let's start with some anatomy. Between the bones of your spine are these little cushions that help your spine move. And as we get older, these discs are naturally gonna change. They can lose some of their water content, they become less flexible, and they can gradually lose their ability to absorb stress or physical movement. These changes are referred to as degenerative disc disease, or DDD. But here are some things important that you need to know. Despite the word disease, disc degeneration is often a normal part of aging. In fact, many people have degenerative changes on their x-rays or even MRI, but don't have any pain at all. So what can cause some of these things? Things like age is one of the factors, but it's not the only one. Genetics, previous injuries, repetitive stress to the body, posture, smoking, body weight, physical activity, and the demands that we continue to place on our spine all influence how our discs change over time. So think about the discs like the tires on your car. The more miles you put on them, the more they can change. But how you maintain them and how you use them can be the key to how your disc degenerates or does not degenerate over time. So let's walk through some common disc type of symptoms. Some people with degenerative disc disease will have no symptoms whatsoever. Others may experience lower back pain, neck pain, stiffness, discomfort that gets worse with certain activities like exercise. Now the reason for this is because pain is a nerve problem. It's not actually a disc problem. But if the structure around the nerve, like we see here, gets pressure on it, then the nerve will send a signal to the body, much like a warning sign or a light flashing on your dash telling you your car has a problem. Discs, due to their close proximity to the nerves, it's common for them to put pressure on those nerve roots. And if a nerve becomes pinched or irritated, compressed is another word, you're gonna experience some symptoms: pain, numbness, tingling, weakness. Sometimes it shoots down the arm or in the leg, for example. In many cases, degenerative changes occur with things like disc bulges, disc herniations, arthritis, and spinal stenosis. So that's why it's really important that we as clinicians look at the entire picture of the human, not just one image, not just one ortho, because we don't want to neglect a disc issue just because you're not in pain. Now, the good news is that seeing degeneration on an x-ray or an MRI doesn't mean that you're destined to live with chronic pain. For most people, conservative care can be very, very effective for these type of things. It typically includes things like structural and resupportive care, chiropractic strength and mobility exercises, maintaining healthy body weight, staying physically active, improving your posture, specific training movement patterns or retraining them, avoiding prolonged activities or sitting. That's just to name a few, but those are some of the most common ones that we work with. Now, the goal isn't necessarily just to make your spine look young again on the x-ray. The goal is to get your body moving better, to enable your nervous system to reduce symptoms, and ultimately to improve your quality of life. So if you've been experiencing back pain, persistent, reoccurring neck pain symptoms, things like that numbness or tingling we talked about, pain traveling into our arms, legs, it's a very good idea to get evaluated, especially those discs, because if significant things like weakness, loss of bowel, bladder control, numbness around certain areas happens, we want to maybe seeing you a little more attentively. So, to summarize, degenerative disc doesn't always mean your spine is wearing out. And it doesn't automatically mean that you're gonna need surgery, but we do want to address these things sooner than later. Spinal changes are a normal part of aging, but what matters is understanding your individual condition, finding the right approach to keep your body moving for the rest of your life. That's the biggest goal for people, is the quality over the quantity. If you found this video helpful, give it a thumbs up, like and subscribe for more health information specifically regarding your spine. If you have any questions, feel free to leave them in the comments. Thank you for watching, and we'll see you in the next video.